Hi, I'm Lucille Zimmerman, and I'm back to talk about some more personality disorders. Again, I want to remind you, if you want an overview of personality disorders, go back to my very first video, and it will kind of explain how they are a pervasive way of seeing the world. There are 10 different personality disorders. I want to also caution you that all of us probably see bits of ourselves in each one of these, but it doesn't mean that you would be diagnosed with that very specific personality disorder. So in order to be diagnosed, you would actually have to have a lot of the symptoms and have them very severely and be on the very extreme spectrum. So again, be careful about diagnosing yourself. So today I'm going to be talking about schizotypal personality disorder. And this is a little variation different from schizoid, which I just talked to you about, in that in schizoid personality disorder, those people are loners and don't care to be alone with anyone. People with schizotypal personality disorder actually have extreme anxiety when they're in a social situation. They're also characterized by having very flat emotions. They prefer to be alone. They are often paranoid and very suspicious of people. They may be eccentric or odd, and they have a lack of any close friends. And 30 to 50% of these people suffer from depression, and you can probably imagine why. No friends, very anxious in social settings. So these people, again, they have paranoid, and they may have these odd, I'm trying to think, like odd quirks. For instance, they may believe they have a sixth sense, or believe in horoscopes, or ESP, or magical thinking, thinking that they can influence other people's thoughts or actions or emotions. They may ramble oddly, have quirky speech, or talk endlessly in a conversation. You can't get them to relax and just feel comfortable around you, even if you've met with that person 20 times. It's not like they're going to eventually feel familiar with you and warm up and relax. Now, causes are, there's a link there between schizophrenia, so first-degree relatives, and also sometimes people may be diagnosed with schizotypal prior to being diagnosed with schizophrenia. So again, the odd speech, suspicious or paranoid, flat emotions, lack of close friends outside of family, and social anxiety that does not abate with familiarity or time. And the way they differ from schizophrenia is that their symptoms may not be as frequent or as intense as someone with schizophrenia. And also, people with schizotypal may be able to be swayed from their delusions, but if someone has schizophrenia, they're probably not going to be able to be swayed. Now, treatment, there really are no treatments. They may benefit from an antidepressant medication, or if under times of extreme stress, maybe some antipsychotic medications for psychotic or paranoid symptoms. Now, as far as movie characters, it was really hard to come up with some, but Robert Duvall's character in The Apostle could be someone that was described with some of these symptoms. And Robert De Niro in the movie Taxi Driver, sort of that odd, kind of goofy, and you can Google on YouTube and watch some clips. And so you might just type in like Taxi Driver and schizotypal. So I hope that's helpful for you, and we'll carry on with some more personality disorders. Thanks.